Children's Healthcare of Atlanta, and specifically in the Aflac Cancer and Blood Disorders Center, we have one of, if not the largest pediatric cohort of kids with sickle cell disease, so the largest cohort of kids with sickle cell disease that we follow longitudinally. And we have their information, so clinical, sociodemographic, and then importantly, medication information in this longitudinal database that we have that goes back until about 2010. So we're talking over 10 years of real world data for how we're caring for kids with sickle cell disease. So in the past, over the past 10 to 15 years, hydroxyurea is known as the first line medication, the first line disease modifying medication for kids with sickle cell disease. And randomized clinical trials, going back again decades, have shown that hydroxyurea works great at preventing some of the clinical complications of sickle cell disease, such as keeping kids out of the hospital, keeping kids out of the emergency department, and then also improving some of their hematologic indices, such as improving their anemia. But the inherent issue with randomized clinical trials is that the nature of the trials means that you're only following these kids for a few years. So 1 year, 2 years, maybe 3 years. And then the issue with that is that hydroxyurea is currently recommended as a lifelong medication for kids with a severe form of sickle cell disease. So of course, it would be important to know for this lifelong medication how the impact of the medication progresses over time. So like I said, we know it works well within the first couple of years, but the clinical question that we had was, does hydroxyurea keep working even after being on the medication for 3 years, 4 years, 5 years? And I'll say going as a clinician, seeing patients with hydroxyurea, the thought we had in clinical experience says that, yeah, hydroxyurea does seem to keep working, but it's good to have, clinical experience is one thing, but then also actually seeing that play out, whether or not that plays out in this real world data, is another important question to answer. So that was really our clinical question. Does hydroxyurea keep working? And so what we did was we looked at our clinical database that includes over 2,000 kids with hydroxyurea. Many of whom, like I mentioned, have been on hydroxyurea for 5 years, 6 years, some as long as 9 or 10 years. And what we wanted to see was, are these kids who are taking hydroxyurea, does the benefit continue? And that was the big takeaway of our finding, or big takeaway of our study, was that hydroxyurea's clinical benefit does continue even after years of use. So what we're seeing is that kids, when you look at the impact of hydroxyurea the first couple of years, so the first 1 to 2 years, we're finding really similar things in our real world data that has been found and verified in randomized clinical trials. So that was good, and that real world usage seems to match clinical trial usage or clinical trial data in that it works that well. But then what we were seeing is that benefit in keeping kids out of the emergency room, keeping kids out of the hospital, persists after years of use for hydroxyurea. So that was our big overall takeaway from the study. One, like I mentioned, hydroxyurea works. Two, the other thing that I thought was interesting that we found in our study, though, was I just talked about the clinical outcome, so emergency department visits, and hospital days. One of the other secondary endpoints that we were looking at was hemoglobin values. So how does hydroxyurea impact anemia in kids with sickle cell anemia? And what we're seeing is that hydroxyurea use that the benefit in preventing anemia actually seems to wane the longer kids are on hydroxyurea. And when we look into the data a little bit more, it seems to be that, or what we find is that for kids who have evidence that they're not as adherent as they should be with hydroxyurea, those are the kids who don't get the hematologic benefits after years of use. And we see, as one would expect, that overall adherence seems to decrease the longer one is on the medication. So what I think this is an important point for providers is that if you have a kid who's been, we focus on adherence at many visits, and just not to get complacent. So if there's a kid who's been on hydroxyurea for 4 years, 5 years, 6 years, and especially if they're entering adolescence, just make sure you continue at visits to stress the importance of taking this daily medication every day, because that's where you're going to see the biggest benefit. So that's one thing. The other thing that I'd mention is that this is a study that uses real world data. So we have a really great database at Children's Healthcare of Atlanta, but databases could always be better. One of the things that's, I think, a limitation of the study, or is a limitation of the study, is that we're looking at outcomes that can be obtained from the electronic medical record, which means we really don't have great patient-reported outcomes. So as we move forward, I think those patient-reported outcomes, such as how often, in the case of sickle cell, how often are kids experiencing pain at home? That's something that we don't routinely collect, and it's certainly not in the electronic medical record. If we could incorporate those sort of patient-reported outcomes into routine collecting of data, I think it can make studies like this even more impactful, because right now it's just a limitation. And we know for many diseases, but especially sickle cell disease, a lot of the complications of the disease are not seen in the hospital. They're not seen in the clinic. They're actually what the kid or young adult is experiencing at home. So incorporating that sort of information into routine clinical collection, I think could be helpful moving forward.